My father, he was in the military 32 years. But basically, in our family, it was a tradition for the boys to serve.
James Farioubough was just a teenager when he went off to war. He survived the jungles of Vietnam for 11 months and gunshots that left his flesh scarred. But his biggest battle began when he returned home.
The nightmares and the flashbacks, they kept coming, and I just kept drugging.
Unable to shake the memories, James became dependent on marijuana, heroin, and alcohol. Over the decades, he went through multiple visits to rehab and was eventually successful in kicking his drug and alcohol habits. But his liver had become weak. At age 50, he was told he had hepatitis C and that he would need a liver transplant.
At first, I didn't really care. I said, now, maybe, it's time for me just to get out of this world. That's the way you feel sometimes. I says, I haven't done nothing. I've wasted my life. My daughters, they got pregnant, both of them. I said, it's time. I said, no, I'm going to fight this. I'm not going to just roll over and die.
James came here to the transplant center at Beth Israel Deaconess Medical Center. Some 40 liver transplants are performed through the center each year, about half the result of hepatitis C, a virus that tainted the blood supply in the 60s, leaving many who had transfusions or who shared needles sick.
Because the current treatments for hepatitis C virus infection do not offer a cure to every patient, patients are progressing to the need for liver transplantation and will continue to do so over the next 10 or 20 years.
BIDMC's Transplant Center specializes in hepatitis C cases, offering patients one of the largest selections of clinical trials for liver disease. They also are one of the nation's leaders in the use of extended criteria donor livers, including donors after cardiac death. The team is available 24/7, 365 days a year to ensure the best chance of a successful transplant.
One of the things that we've emphasized in our program is a short preservation time. We tend, not to just sort of wait until the morning to do the transplant. We'll do these transplants anytime, day or night, to try to minimize the preservation time, and we think that that improves outcomes after liver transplant.
The center is also unique in that it geographically and functionally works as a cohesive unit. Transplant physicians, nurses, surgeons, social workers, dietitians, psychologists, and others, all located on the same floor.
So it makes exchange of ideas about patients' care very easy. And it means that things happen at a fast rate. It means that I can walk out of the clinic room and walk into the office of a colleague to discuss the patient's case. And it really is a team approach.
James had his transplant in February of 2006 and soon was back to his job as a courier. Within weeks, he made enough money to save his home from pending foreclosure.
Dr. Curry says I'm a miracle because, he never seen no one heal so fast like I did. I can't even, they were so great. From the secretary on up, they are a great bunch of people.
Here, there's yours.
He's back to his family, too. He credits his wife, his daughters, and Beth Israel Deaconess for his new lease on life.
I was in horrible shape, and I got a second chance, I say. I get my grandkids that I thought I would not see. I'm very thankful, very.